Okay guys, so good morning or good day whenever you're watching this video. I hope that you are doing fine and you're safe as well as your family. So we're already at week 16 and I'm very happy to announce and congratulate you in advance. A few more weeks and you're at your second level. So we're just going to do a quick episode for this health assessment for our abdominal area. So let's begin first with the devotional. Our devotional is entitled Nothing is Useless. It's inspired from this book, Our Daily Bread. Okay, annual edition volume 25. It's on June 12th. Okay, so let me read the memory text for today. Okay, so let me just slide in. Okay, so there we go. Our devotional is Nothing is Useless. Okay, so it says here, 1 Corinthians 15 verse 15, chapter 15, verse 58, it says, Nothing you do for the Lord is ever useless. So this is a great promise. So let's read the devotional. In my third year of battling discouragement, depression caused by limited mobility and chronic pain, I confided to a friend. My body is falling apart. I feel like I have nothing to value or offer to God or anyone else. Her hand rested on mine and said, Would you say that it doesn't make a difference when I greet you with a smile or listen to you? Would you tell me that it's worthless when I pray for you or offer a kind word? I settled into my recliner. Of course not. She frowned. Then when? Then why are you telling yourself those lies? You do all those things for me and for others. I thank God for reminding me that nothing we do for Him is useless. In 1 Corinthians 15, Paul assures us that our bodies may be weak now, but they may be raised in power, because God promised that we will be resurrected through Christ. We can trust Him to use every offering, small effort done for Him to make a difference in His kingdom. Even if we're physically limited, a smile, a word of encouragement, a prayer, or a display of faith during the trial can be used to minister to diverse and interdependent body of Christ. When we serve the Lord, no job or act of love is too menial to matter. So, there is a small prayer here. Jesus, thank you for valuing us and using us to build up others. So, as future nurses, this is a simple reminder for us that in the small things that we do, especially if we dedicate our work for the Lord, it is not insignificant, even if no one praises you for that, even if no one sees your good work. Don't worry, that because the Father in heaven is looking down on us in love and is really glorified when we do those things, especially to our patients. So, with that, let me ask you to bow our heads as we pray. Let us pray. Most gracious God, loving Heavenly Father, we thank you, Lord, for this wonderful day that you had given to us. We come to you, Lord, in prayer to ask for your guidance, especially as we study our lessons right now. May the listeners of this prayer be blessed, Lord, with your grace and mercies for today. Bless the families, Lord, of the students that each we represent, and bless the faculty and staff of Manila Adventist College as well. Help us and keep us safe, Lord, from this pandemic. May we glorify you, Lord, in everything that we do. In Christ's holy name we pray. Amen. Okay, so without further ado, let's proceed to our lecture for today. Okay, so again, we're here at week 16. Very good for you guys to kept it in the until the end. We're in the abdominal assessment. We're already done with the reproductive system last time by Ma'am Herda. Now we're going to do our health assessment. So let's dive right into it. Okay, there's a definition here. Let's just define terms. Let me just small or lessen my camera size so that it's not disturbing. Okay, there we go. Okay, so when we say abdomen, okay, it is border superiorly. Oh, sorry for the handicap. Okay, it's bordered superiorly by the costal margins, inferior to the symphysis pubis and inguinal canals. Okay, and laterally by flanks. Okay, it is important to understand the anatomic divisions known as the abdominal quadrants and abdominal wall muscles. So we'll just have a quick review of this one. And internal anatomy of the abdominal cavity, in which later we could perform physical assessment. So it's good to know the normals before we go to the abnormals, and we could see whether or not we are doing it right or not. Okay, moving on to the next slide. Let's have a review. I know that you have done this with our anatomy and physiology, but for the sake of review, here are the quadrants. Okay, on this side, this is the right patient side. We have here the right upper quadrant, or we could call it RUQ. Okay, on the lower part of that segment or side, it's your right lower quadrant. Okay, so meaning quadrant, meaning four. This is the, let me just emphasize it with the lines. Meaning four, here is your right upper quadrant, here is your right lower, here is your left upper and left lower quadrant. These lines, what all organs that falls within this line in the middle, it's midline. Okay, that's just a review. So for the four quadrants, we have this. We go to the next slide. Okay, so let's be specific with each quadrant. So as you see on the screen, we have here the organs that are in the border of the right upper quadrant. Right upper quadrant meaning this square. Okay, your anatomical position would be just below the rib cage kasi you could not assess through your ribs. So all organs under the rib cage would be considered under that quadrant. So what are the, let me just go through the organs which are located at the right upper quadrant. First, we have the ascending and transverse colon. So meaning ascending, going up, this is your colon. Let me just change ink. This is your ascending colon. Okay, so a part of your ascending colon, and your transverse, meaning this one. Okay, so that's your number one. You have your duodenum. That's the part of your. You have also your gallbladder here. Okay, hepatic flexure of colon. So it's here. You have your liver, the largest organ here, aside or a part of the liver. You have the pancreas head. It's not seen here in the description, but it's there. Later would be just passing through that. Okay, so the pylorus or ileum or the transverse walls, it's also there. The right adrenal gland. If your kidneys are here, your right kidney, it's just located above. And your right kidney, as I have drawn here. And your right urethra, usually your urethra for there for excretion. Usually it's located here. These are your ureters, passage of your urine. So that's just a review of the organs in the right upper quadrant. So take note of this. If yun, reminder again, included in the study guide or video for today is your study guide. You could answer it with me as we discuss it through the lecture or lessons. So it serves as a review. All the examinations and quiz would be taken from that study guide. So if you could answer it, it's much better. Okay, so your muscle memory for writing and retention is enhanced. Okay, so let's go with the right lower quadrant. So we are talking about this part. So what are the organs found in that part? We have your appendix. If this is your large intestine, there is an apparatus or excess skin, or what do you call this, organ here. That's your appendix. You have your ascending colon. Okay, so this one going up meaning ascending. You have your cecum. It's not that much shown here. Okay, you have your kidney. I've drawn the kidney, for example, here. The lower pole. For females, okay, you have your right ovary, right ureter. This one I also emphasized earlier. And for male, the right spermatic cord. These are the organs found in your right lower quadrant. So I won't be emphasizing on this one, but because you have already passed through this from your anatomy and physiology, we're just here to have a review of the organs found there. Okay, so a question might be, sir, why is it important that we must indicate where the quadrants are? So basically, these are just like addresses or areas. Okay, so let's just say that this is, for example, Luzon is divided into different provinces or provinces. For example, Metro Manila is one. You have also Cavite as another state. So this one is just segregating it for you to able to localize it. Okay. For example, yan, Metro Manila. For example, your whole is the whole abdomen is Metro Manila. It's divided into Pasay, Pasig, okay, and other regions or other cities. So it's just localizing or making sure that it's on a same place. Okay. We go to the next slide. So we go to the left upper quadrant. So what do we have here? So for the left upper quadrant, pertaining to this part, sorry for that, to this part. So what are the organs here? We have your left adrenal gland that's located above your left kidney. Okay, so there are two. Your left ureter. Okay. You have your pancreas, the body. Where is the pancreas located? It's located just proximal to the stomach. Sorry. I mean, sorry. It's the spleen pala, sorry. The pancreas is also there. It's not that visualized here. It's behind the liver. The spleen is, let me correct myself for that. The spleen is near your stomach. Okay. The stomach itself. Okay. Here it is. And the transverse and descending colon. So, this is still transverse. And this is your descending colon. It's not shown here because of the small intestine, but your descending colon is here also for the large bowel. Okay. So this is your descending. Okay, so these are the so this is the descending for the left upper quadrant pala. Okay, so that's the descending. Let's move to the next one. It's interconnected. So you have here your kidney, the lower pole. Usually the kidneys is located here above, and the lower pole is here. For females, you have the left ovary, the left ureter for both male and female. For the male, you have your spermatic cord, okay? And then the descending sigmoid colon for uh, both gender, okay? Let's go to the next line. Midline, okay? So we have here our bladder. This is where the urine is stored. For female, the uterus. And for male, the prostate gland. And we would be discussing it further in detail later on. Okay, so here are the regions of the abdomen. So, for example, in Metro Manila, this is the most specific parts. Okay, so this is for your, diba? Let me just scribble over this one. We have our yellow is a bad idea. First of all, we have our quadrants divided by 4. Okay, now we have our regions. This one is pinpointing the location even more or more precise. Okay, so let me just remove this one. Okay, so for this side, let's start with the right side again of the patient. So this one is the right and this one is the left side of your patient. For the right upper quadrant or the right upper portion, we have here our right hypochondriac region. Okay, so basically we would be passing this one, and then let's go here for the top layer first. Above is your epigastric region. So if you're going to enumerate, just remember these 3. Okay, this 3, your epigastric, your umbilical, and hypogastric. Kasi because these are the changing names that is presented here, and usually if you answer it right, hypochondriac region here, the opposite side would be just the same. and the location would just be changing. Okay, so hypochondriac area, we have our epigastric region, which is the center of both left and right hypochondriac region. We go to the middle part, which is the right lumbar region here. The middle part of that one is your umbilical area. So if you have skin on there, okay, so this is your patient. Usually the umbilicus or your belly button is located here in this area. Okay. And then situated on the left side of your umbilical region is your lumbar region here. Okay. So you could see it there. And then here in the lower part, here is your iliac crest, yung hip bone natin. Sorry for having Tagalog. So for your hip bone, this is your right iliac or inguinal region. In the middle of your right and left inguinal region is your hypogastric region, meaning hypogastric below the stomach area or your intestine. Okay. Sir, why is it not hypo umbilical area? For science purposes, they named it like that. Okay, so to avoid confusion, so they just named it hypogastric area. And then right iliac spine, your inguinal region. Okay, this is another picture showing this one. Okay, so your quadrants, right quadrant, these are your regions. Okay, when we say regions, it's the 9. Okay, let me just clear. When we say regions, this is your 9 specific areas. When we say quadrants, from the word itself, quad, it's meaning square or 4 sides. It's your 4 sides. Okay? So don't get confused. What region of your abdomen is you're pertaining to the 9 places. Your right hypochondriac, epigastric, left hypochondriac, etc. If you're pertaining for the quadrants, you must be answering your right upper, right lower, right left upper, and left lower. Okay, so don't be confused on that. Okay, let me just turn off my camera so that it's more feasible for you guys. Okay, so let's go to the abdominal wall. So the abdomen is protected by layers. So first layer is your external abdominal oblique. Okay, so that's the outer part. Okay, outer part. This one is chiseled, but for patients having what do you call this? Fat stored, usually abdomen is just lying just beneath the fat area. So this one usually is fat, and abdomen just rests beyond the fat area. Okay, so there is your external abdominal oblique, that is the outmost. So if you're answering your modules with me, this is the answer for the number 1. Okay, that's the outermost layer. And then we have the internal oblique. So we're done with the external. So one layer below, this is your first layer, which is your external or outside abdominal oblique. Your second layer is your internal oblique. That's your middle layer that protects your abdominal wall. Okay, so beyond your internal oblique, we have our transverse abdominis. So this is the innermost layer. So kumbaga, this is their level 1, the outer part, your middle part. Sorry for using and your innermost layer. So this is inside. So layer 1, layer 2. Inside the layer is your transverse, which is your third layer. Okay? So those are, so basically it does protect the abdominal or abdominal cavity or wall from injury, and it serves as movement, as we have already studied with our musculoskeletal area. Diba? Muscle serves as protection and provides movement as well. Okay, so further definitions about the abdominal wall. So muscles protect the internal organ and it allows normal compression during functional activities. So try it or try to observe when you're trying to cough, your abdominal area tightens. If you try to sneeze also, sudden sneezing, try holding on your abdominal area. It tightens as well. So that tightening is called compression. Therefore, you know that your muscles on your abdominal walls are working as well. So as well as urination, sometimes, diba, if you need to urinate or you want to force it, you try to you do some forcing or Valsalva maneuver. That's the main term for it. Basically, it's like forcing, or in Tagalog, it's called iire. So pag umire ka ng kaunti, that's forcing or Valsalva maneuver. Urine and defecation do it like so. And especially during childbirth. So we could all see films that would say, okay, ma'am, uh, try to deep breathe and do deep breathing, and then do a forceful push on your abdominal area. Therefore, that's the thing that they're doing when compression of muscles is uh, involved. Okay, so that's the main purpose of your abdominal wall. Okay, so let's move on to the next type. Aside from the layers, we also have two types of peritoneum. Maybe you're familiar with this one. We'll just be passing through for this one. First, we have the parietal peritoneum. Okay, here. What is the parietal peritoneum? It's the thin, shiny serous membrane in the peritoneum lines that is located within the abdominal cavity. Okay, so we have here your parietal peritoneum, the thin, shiny line between your abdominal area. Okay, that's what you call your parietal peritoneum. Okay, when we say visceral peritoneum, these are serous membranes that lines along the abdominal cavity and also provides protection from for the most internal abdominal organs. Okay, so usually when we say parietal peritoneum, it's more of the outer layer, and when we say visceral peritoneum, it's the most internal abdominal organs. So for example, here, I could not zoom in pala dito, but let me try. Oops, sorry. Let me just go back to the airplane and go to the notes. Okay, so here we could see this is your visceral peritoneum. So when we say serous membrane, it's a little bit composed of liquid structure. So here is your visceral peritoneum. So it's filled with fluid. Okay, it's in the inner part. So this is your parietal, and your visceral is located in the innermost part. Okay, so let's talk about abdominal viscera. So when we say viscera, this is your organs within your abdomen. Let me just simplify it. Okay, so abdominal viscera, when we say viscera, is the organs within that cavity or compartment. Okay, so a definition for this is the structures within these layers of abdominal protection are used as internal organs. That is what I defined earlier. These anatomic structures belong to various body systems. So take note of the system that is included in your abdominal area. So first system is your gastrointestinal. This is responsible for your food and nutrition. Next is your reproductive area for the female, because you have there your ovaries and uterus. You also have our lymphatic. Lymphatic system is responsible for your immunity and combat against infection or any foreign objects. And your endocrine, this is more of your adrenaline and sugar levels. Usually when we say endocrine, it's more of your hormones and balances in the body. And last but not the least is your urinary, elimination of excess waste materials through the body via our urinary tract. So again, what organs are, or what systems are involved with your abdomen? We have first your GI tract or gastrointestinal tract. We have your reproductive system. We have your lymphatic system, endocrinal system, and then your urinary system. Okay, so there are two types of viscera, two types of organs. Let's just, okay, when we say viscera, let me just to be clear, for layman's term, it's just organs found in your abdominal area. So we have our solid and we have our hollow. Sir, why is it solid and not liquid? We'll be discussing it later. So when we say solid viscera, these are the examples. We have here first our liver, next is our spleen, next we have our pancreas, and then our kidneys, and then our adrenal corticoids, and the ovaries for female. Okay. So when we say solid, it's more of a mass and it does not contain fluids or air inside of it. Okay, so it's more of a whole cell or a whole organ in itself. Okay, so when we go to our hollow viscera, examples would be our stomach. Okay, so stomach is hollow. Usually your gastric juices and acids are stored there. So it has liquid inside. Okay, so intestine, both large and small, are hollow viscera because it contains the roughage from your digested food. It also contains a little bit of air and a little bit of fluid inside of it. You also have your gallbladder. Okay, it fills or it stores your bile for digestion of fat. And then you have your urinary bladder. Therefore, basically, it is responsible for holding in your urine or your pee. And last but not the least, it's is the uterus for female. Okay, so it's hollow in origin and it houses the baby during pregnancy stage. Okay, so now we're going to proceed to our solid viscera. So when we say solid viscera, it's your solid organs. Okay, let's just proceed. Okay, let me just turn off my camera again. Okay, so that you could visualize. First, we have here the liver. So what is the function of the liver? First, it filters the blood coming from the digestive tract before passing to the rest of the body. So basically, it helps as a filter or cleanser. Okay, so number one function is it filters the blood. Number two is the liver acts as a detoxifying organ. So it detoxifies chemicals and metabolizes drugs. So here we could see here that if the patient or your client has a tendency of drinking too much alcohol and metabolic drugs, there is a tendency to have damage in the kidneys for him or her. Okay, so another function of your liver is it secretes the bile. Okay, so take note. Let me just be clear on this one. When we say it secretes, it creates. So your liver is responsible for creating the bile, and your gallbladder here is just responsible for storing the bile in your body. Okay, so it is important also for blood clotting and other functions. So let me just underline also the it has a role in blood clotting. Okay. So I won't be discussing on it because it's very overwhelming. Your clotting time, bleeding time, and other parameters. It's located here, but it's located. The location of your liver is usually, as we have said earlier, in your right upper quadrant, and it extends from your right hypochondriac area to your left hypochondriac area. Basically, the anatomical position. Moving on to the next organ, we have next our pancreas. So this is our pancreas. Okay. So what does the pancreas do? So basically, the pancreas is responsible for creating pancreatic juices. Sir, what is the pancreatic juices? It's aka or also known as your enzymes. So enzymes are responsible for breaking down your sugar, your fats, and your starches. So with problems for your pancreas, usually breakdown for fats, sugar, and starches are affected as well. Okay, so the pancreas helps in the digestive system and it acts also by triggering and making some hormones. And these chemicals are also enzymes are also messengers that travels through blood that triggers your brain to release hormones to specific areas of your body. So basically, this one is responsible for creating the impulse or message for the brain traveling through your bloodstream. Okay, so where is it located as well? Your right upper quadrant. and it's between your right hypochondriac region and epigastric region. Okay, so let's be moving on to the next solid organ is your spleen. What is the function of the spleen? It acts as a filter for blood as well, like your liver, but it's more of a part of your immune system. So, where is our spleen? So, this is your stomach or your gastric area. The spleen is just attached near your stomach. Okay, this is your spleen. Okay, so um, what does the spleen do? So, all red blood cells are recycled here in the spleen. Okay, so platelets and white blood cells are stored also here. So basically, your defenses of your circulatory system are stored and generated here in your spleen. Okay, as a part of your lymphatic or your immune system, the spleen is also responsible in fighting certain types of bacteria. Okay, that may cause pneumonia and meningitis. So usually, inflamed spleen might cause or might result to infection in your body. So this is the part of it being a soldier in your immune system. So where is it located? Your spleen, it's in your left upper quadrant. Okay, so if you're going to draw your quadrant here, it's in your left upper quadrant. And what part of your region? When we say region, it's the 9. It's here in your left hypochondriac region. Okay. Let's move on to the next. We have here our kidneys. So basically, the kidneys has a lot of function, but it's summarized here. Its job is to filter your blood. So what are the organs responsible for filtering your blood? First, we have our what? Our liver. But the blood that is filtered more on that is the blood from your digestive tract. Okay. And another one is your spleen. The third one that is responsible for filtering your blood or your circulatory system is your kidney. So basically, the kidneys removes waste in the whole body. So the whole body, all the waste materials in the circulatory system passes through the kidneys. Okay, it also keeps the fluid balance. Okay, and keep right levels of electrolytes. So your sodium, potassium, and chloride and other electrolytes are maintained in your kidneys. The balance is maintained or regulated by your kidneys. Okay, so blood comes also into the kidneys. So what happens is your kidneys are connected in your arteries and veins. So basically, it passes through your veins, carries unoxygenated blood or from the system going to the kidneys to be filtered, and then clean blood goes out from the kidneys and back to your arteries. Okay, to be pumped to the rest of the circulatory system and peripheral vascular system. Okay, so when blood comes to the kidneys, waste gets removed, so it acts as a filter. It cleans your blood. Okay, it regulates your salt, water, and other minerals. It adjusts it if it detects that the body is a little bit salty. Let me waste some of the salt so that it would be balanced in the whole system of the body. Or for example, there is too much water in the body. Let me filter it out, and then let me just divert it going to the ureters and then the bladder so that it could be eliminated later on. So that's the major function and role of your kidneys. And then the filtered blood goes back to the body, and then yun nga, what I have said, filtered or waste materials that may be excreted through the urine would be excreted. Okay. So where is it located? Since it's left and right for the kidneys, you have here your right kidney and your left kidney. It's located in both upper right and upper left quadrant. Actually, these one are in the borderline of your upper, right upper and lower, and the borderline as well of your left upper and left lower quadrant. Okay, so for the regions, it's both found in your left and right lumbar region. But some patients or uh, some patients has it in a different border depending on their anatomical structure, but usually they are found in the lumbar regions of your patient. Okay, so when we say uterus, okay, so take note. You might be asked, where is the male uterus found? So take note, uterus are only for female patients. Okay, so remember, uterus are just for female patients. Okay, so what are the functions of the uterus? So we all know that our abdominal system is also responsible for reproduction. So this one is also a part of your reproductory system for females. Uterus, its function is called the womb. It is an inverted pear shape. So let me just emphasize on it. So it's like a pear. For example, that's your pear. It's just inverted. Okay, that's just for illustration purposes. And then it's located between your bladder and your rectum for female. Okay, for female, for example, this is your buttocks. That's your rectum on the other side. The vaginal area is on the front side. Okay, and then it nourishes and houses fertilized egg. So during the course of production, the egg goes here, the sperm meets the sperm and egg meets here, and then the baby forms in your uterus, and later on after some months it would be formed into the baby that we all love and adore. Okay, so that's the part, or that's the main responsibility or function of the uterus, especially in pregnant women. Okay, so where is it found? Mostly in the quadrants. If you're going to divide it, it's in the midline. Sorry for not being straight, drawing straight. Okay, so it's located in the midline. Your umbilical area is usually the point of your quadrants. Yung that's the main point of your intersection. So it's located at the midline. If you're going to locate it for the regions, so let me just divide it by 9. Okay, so it's located in, oh sorry, it's not that perfect. Okay, so the umbilical area is that. Just below the umbilical area, so what's that area called? It's your hypogastric region. That's the location of your uterus. Okay, so we're done with the solid viscera or organs of your abdomen. Now we're on the hollow viscera. So let us discuss what are the contents of your hollow viscera. Okay, so for the hollow viscera or hollow organs of your body, first is your stomach. So what are the three functions of the stomach? It's indicated here that first, it's a temporary storage of food. So take note of the word temporary. Your food does not get stuck in your stomach for digestion. It just stays there for a bit of time for it to be processed or digested. Okay, and then it passes from the esophagus where it's held for 2 hours or longer. So that's why when you eat food, usually it's stuck there for 2 hours to be melted by your gastric juices, and later on would be processed through your small intestine, and later on the other parts of your digestive tract. Okay, so first is temporary storage of food. Another function is it helps on mixing and breakdown of your food. So aside from being a storage, it releases enzymes or gastric acid to help in mixing and breakdown. And then later on, another part would be it helps in contraction and relaxation. So basically, it's just a term for it facilitates movement of food. Okay, facilitates movement. Okay, so the contraction and relaxation. Okay, so contraction and relaxation of your stomach causes your bowel movement, or usually, diba, if you have all if you're hungry, try palpating over your left upper quadrant, or your gastric area, epigastric area. You would be seeing that your stomach is either moving by itself, signaling you that you're hungry, diba? There's some movement there. Usually, that's the contraction and relaxation of your muscles, signaling you that you should eat, and so that it could process the food, okay, for digestion. So, where is your stomach located? It's in your um, left upper quadrant. It's located there. Okay, so if we're going to divide it for your quadrants, majority of it, oh, my umbilical area is too high. Let me just draw it again. So your umbilical area is a little bit here. So it's in your left upper quadrant. And your region, it encompasses your epigastric area. Okay, so if we're going to draw regions, it's your umbilical area would be here in the middle. It encompasses your epigastric area to your left hypochondriac region. So that's your stomach. Okay, let's move on to the next one. This is your gallbladder. This one is a hollow viscera. So what is the function of your gallbladder? As what I've said earlier, it's just beneath your liver. Your liver produces the bile, and your gallbladder is there to store the bile. So what is the responsibility of the bile? Okay, so let me just first go on with the movement. So it signals the gallbladder. Usually your gallbladder squeezes in bile to the small intestine to help out break down the digested fat. Okay, so if you're into fatty food, um, think this small organ. So as what they have discussed also with nothing is useless. It may seem that this organ is insignificant, but it really helps a lot, especially with breakdown of your fats. Okay, so let's define it further. So its response to the signal, it releases the bile into the bile ducts. The bile help digest fat, but the gallbladder itself is not essential. So say, let me just emphasize on this term. Gallbladder itself is not essential. Okay, so basically, your gallbladder is the one storing your bile, but the one who is producing is the liver. So for patients having inflamed gallbladder or cholecystitis, later on in the checklist, you would be encountering that. So gallbladder is your inflammation of it is called cholecystitis. If you're positive with this one, and if ever your gallbladder will be removed during an operational procedure, your digestive tract would be still functioning kasi there's still uh, a tract here, your hepatobiliary tract, that leads directly as well to your small intestine. So this is your small intestine. The violet displays the area in which the liver could directly secrete the bile. The gallbladder is just there essential so that if you're eating too much fatty food, and there's a tendency that your gallbladder gets irritated because of too much fat intake, then it becomes inflamed or swollen up. Then that's the time that you would be experiencing abdominal pain, especially in the right upper quadrant, and then the doctor would be removing it. Even if the gallbladder is removed, bottom line is your digestive tract would still function as well. Okay, that's why in the definition itself, gallbladder itself is not essential because um, it's just there to function for storage. Okay, so it's located in the right upper quadrant in the epigastric region. So for the small intestine, so we have here your small intestine. Let me just highlight it. Okay, so here is your gallbladder. After going with the gallbladder, these are your small intestine. So encompassing all of the violet highlight, those are your parts of small intestine. So what does your small intestine do? Okay, so basically it absorbs all the nutrients from what we eat or drink. So all the your stomach broke down the food, so it's from that big chunks, it's now already in a semi-liquid form that would be passing through your small intestine. The intestinal walls in your small intestine would be absorbing all the vitamins, minerals that could be used by the body for its sustenance and survival. Okay, so usually it's made up of velvety tissues that line the small intestine, that is divided into your duodenum, jejunum, and ileum. Basically, those are just the parts. Okay, it's located in almost all the quadrants of your body. If you're going to divide it, it's located almost in and distributed in all parts of our body. And the area, sometimes it's more of the umbilical area and hypogastric area. Okay. Then we go to the large intestine. Okay, so we're done with the small intestine. Here is the large intestine, all with the black highlights are your large parts of your large intestine. Okay, so basically what happens is during digestion, let us review. You eat your food, goes through the esophagus, it stores in your stomach for 2 hours at least. It breaks down the food. If ever there's fat, the liver and the gallbladder would secrete the bile. The bile is responsible for uh, making or giving color to your excretion through your rectum or poop, basically. And then after passing through the stomach, it goes to your small intestine. It goes to the loops of your small intestine. After going to the loops of your small intestine, it enters your large intestine. So let me change ink color. So food here, usually the um, parts here in the large intestine or processed food in the large intestine during the digestion is more of the roughage. So this one are the unwanted parts, but it's still wet and it has a lot of content of water. So basically, your colon or your large intestine absorbs water and it segregates the waste. So when I say waste, it's your roughage in the body that can't be stored inside your stomach and intestine. Okay? So when it enters your large intestine, it travels to your ascending colon, the transverse colon, and later on going your descending colon. And then if ever it's already full or if it moves, the excess or the soils or the waste products get stuck in your rectum and then gets eliminated through your anus as defecation or poop. Okay, so uh, basically the location for quadrants, it's evenly distributed in all quadrants, especially in parts, and for the region, it's also distributed in regions. Okay, so for quadrants, just imagine it's in almost all quadrants. Just the specific parts you would be just naming it, and then for your regions, okay, it almost is almost included in all of your regions. Okay, another thing or another important organ is your urinary bladder. So it's also hollow because it stores your urine. So urine is made through the kidney. So basically, the body the blood is filtered through the kidneys. Excess water or waste products are excreted going down to your ureters. and it goes directly to your bladder to be stored and later on eliminated as urine. Okay? So the bladder stores urine, it allows urination, and it frequently controls. And the bladder is lined of muscle and tissues to stretch and hold urine. So usually it's just small in the start, but later on, if there's a lot of fluid accumulation, you could still store it, okay, and then later on, gets eliminated. So uh, this one you could see here in the side view version. This is just for the male um, urinary system. So the bladder is just located here. So where is it located? Usually it's on the midline. So basically, here's your bladder. If you're going to divide this one, this is in your midline. The specific area for it is in your hypogastric area, below your umbilical area. Okay, if you're going to palpate it, um, it's if it your bladder is full, you would be able to easily palpate it, especially if you really want to void and you're just trying to hold your urine. Usually it's there. You could palpate it that it's full. It's a little bit hard to palpate. And just be careful if palpating on a full bladder, especially if you don't have urinary problems. It might urge you to void. That's movement of the muscles. As we have said earlier, construction, contraction of the muscles would cause you to void. So, upon assessing, just try it yourself. You could assess it and be wondered on how God has created us in the systems, in the abdominal system. Okay, so now we're going to talk about the abdominal vascular system or your circulatory highway in your abdomen. Okay, so here is your pipeline of your abdomen. Okay, so basically, let me just see how this would how could I explain. Okay, so your unoxygenated blood or blood from your system that had been used would be passing through. This blood contains all the waste materials. It either goes in your left or right kidney. The kidneys, I'm just simplifying it for you to understand. So this is your, for the up from the upper extremities and lower extremities, all your blood that has waste products are there. Okay, it goes to the kidneys. The kidneys would be filtering those blood. Okay, and then later on, the filtered blood would be passing through your arteries, and it would be distributed to the organs or the system that needs those um, filtered or clean blood. So basically, that's just how the abdominal or vascular structure works. Okay. Let me just discuss this one quick. Are you familiar with your abdominal aortic aneurysm? Okay. So basically, this is a condition. I guess you've heard of this one. Before, there was a case of this flight stewardess that recently passed because of the ruptured aortic abdominal aneurysm. So when we say aneurysm, it's weakening of the blood vessels, causing it to burst or rupture. Maybe he or she has, maybe she has a pre-existing condition that is not known to her. That's why it triggered and led to internal bleeding and later on became the cause of death. So when we say abdominal aorta, it's here. Usually abdominal pressure, if you have predisposing factors or something triggered it to weaken, this is your abdominal aorta. Once the walls would weaken or swell, it would cause it to have aneurysm, swelling or abnormalities. And then when that swelling burst out, that's what you call rupturing. So basically, that is that the collapse of your aorta. Since this one is a rich an environment rich with blood, and it's responsible for filtering your system. Blood in the abdominal area is really irritative and lethal, especially if not addressed immediately. This one is a really life-threatening situation because it's near your vital organs, and it interrupts the flow of your blood. That's why abdominal aortic aneurysm is really dangerous. Okay, and make sure to, if ever you're going to palpate your aortic vessels, there is a part here. Make sure that your patient is stable and has no history or predisposing factors to develop AAA, or abdominal aortic aneurysm. Okay, so let me just emphasize on that. Okay, let's go to the prostate. This one are just additional glands because it's still part of your abdominal area. So for male, okay, for the female, there is your uterus. That's the designated organ for the female reproductive system. For the male, we have the prostate. So what does the prostate do? It's the gland that produces some fluid that carries the sperm. So this one usually lubricates the sperm and carries it during reproduction or release. Okay, so the prostate gland surrounds the urethra. So let me just highlight it. Just a little bit of review. Okay, so if this is your bladder, the prostate of a male is just located just below the bladder. Okay, it has a duct that goes to the male genital system that aids the sperm. Usually, the sperm is in the testicles stored, and it just helps transport and lubrication. It has a common space that would be released during reproduction. Okay, so this is your prostate, and this is your urethra, bladder. Okay, so what does this do? If ever there is enlargement, I have here in the bottom part. Okay, so let's just first emphasize on this one. Okay, if ever the normal prostate, okay, so here's your bladder, here is your urethra, it passes through the prostate. So the normal thing is urine from the bladder passes freely to the urethra without the interruption of the prostate. But if ever there is an episode of enlarged prostate, what would happen? You could see here is, instead of the urine passing through the urethra freely, enlargement of the prostate causes your urethral or your urine path to narrow, therefore having urine retention. Okay, so giving the patient incontinence in urinating, or having a hard time in urination because of the narrowing of the passage of urine. Okay, so usually the term for it is BPH, or the enlargement would be BPH, benign prostatic hyperplasia, meaning the enlargement of your prostate gland. Okay, so is it normal to have enlarged prostate? According to the reference, the older the person gets, there is a tendency to have an enlarged prostate in almost all men. Okay, now we're in the end part of their last large intestine. So this one is your portion where it acts, the rectum, it acts as a temporary storage for the feces. So basically, waste materials and food are stored temporarily. So it's not stocked for a long period of time in the body. Okay, so it collects the waste materials from your descending colon. So let's just have a review. So from the small intestine, it goes to your ascending colon, it goes to your descending colon, and then your feces would be stuck here. And then later on, your abdominal area would urge contraction of muscles, which is also called peristalsis. That's the movement. Oops, sorry. We just go back. It's just the movement called peristalsis, the contraction of the muscles for the digestive tract to move and uh, let the food pass in the process of digestion. Okay, so why did I discuss the prostate exam and the prostate and the rectum? In male patients, this is how you would be assessing your prostate. Okay, so the examiner would this exam is called digital rectal exam. It's a test that examines the person's lower rectum. It's a combination for male patients. So it may be done for female patients, the digital rectal exam. And it assesses the rectum, the pelvis, and the lower belly. Okay. So this test can also check for cancer. It could also check for hemorrhoids, meaning blood accumulation in the rectal area. And it includes the assessment for male patients, the prostate cancer or prostate enlargement. So, what the doctor or the examiner would do is he would ask the patient to bend over with a lubricated glove. With a glove and a lubricated lubrication, the doctor would insert a finger in the rectal area of the patient, assessing for the patency, assessing for the structures, if it's smooth, if it has lumps, bumps, okay? And they would be assessing the prostate. So bending over would help the doctor anatomically um, position the prostate for assessment or examination. Okay, basically this exam, the digital rectal exam, also indicates if there is problem with your um, muscle in your anal area. Usually the sphincter muscles there contracts when there is stimuli. Usually it's included in the digital rectal exam. So it's just nice to hear, but take note, we're not doing this assessment. We'd be just focusing on the assessment of the abdominal area. Okay, so let me just pass through this one as well. So, as what I have already included, I'm very sorry if you're eating something. You with nurses would just be joking about this. So, at this early point of time, I'm asking you or I'm priming you to be familiar with this one kasi this one are just common terms when it comes to nursing. Okay, so hemorrhoids are swollen veins. So there are veins in the part of your rectal area that sometimes protrudes. Okay, so some blood vessels stretch and some blood vessels bulge, and that sometimes when they get irritated, they are cut. Okay, so how will I explain this further or simpler? Let me just think of a term. Okay, so when these blood vessels are bulged, it gets irritated when there is waste materials that passes through here. Kasi we all know when waste materials passes a delicate blood vessel, it has a tendency to get scratched, and later on, since it's a blood vessel, it has a tendency to bleed as well. So when we say hemorrhoids, usually these hemorrhoids have the tendency to bleed. Some hemorrhoids are not bleeding, but they are really distinct, especially in older clients or clients with bleeding disorders. Okay, so hemorrhoids could be also called as piles. So we have two classifications of hemorrhoids. We have the internal hemorrhoids that could be palpated during digital rectal examinations. Those are inside your anal area or rectum. And we have your external, which is protruding outside your anal area. Okay, let me just move on to the next. Okay, so we're here in collection of data. I'll just be passing through here. Okay, so for the subjective data, this includes the history of present health illness. Let me just turn on my camera. Okay, this includes the history of present health concerns. It includes the interview questions that you may be doing in advance. Okay, so including of the question would be presence of abdominal pain, indigestion, inability to digest food properly, nausea, meaning later I will be discussing this one, nausea and vomiting, appetite level, is it increased, decreased, or just the same? Bowel elimination. And later on, we have here the personal health history, family health history, lifestyle practices, and routinely asked question for the subjective data. Let me turn off my camera so that you could proceed later on. Okay, so abdominal pain. For abdominal pain, we have specific indigestive organs. The structures are either affected by chemical or mechanical factors. Okay, so take note. It might be chemical or mechanical factors. These factors may be classified as inflammation, infection, distension. When we say inflammation, okay, when we say inflammation, this one is the enlargement or swelling of the organ, but not necessarily there is a microorganism causing it. Usually, it might be a chemical reaction again or a mechanical reaction. It might be because of infection. This one, you have your microorganism that is responsible for the inflammation. Therefore, we include infection in the process. Okay. Then we also have distension. This one is being enlarged for a prolonged period of time. We also have stretching. This one is the elasticity of your abdominal area. Sometimes it's more of the pressure. The pressure is building up. That's why it causes the pain. Sometimes it's caused by an obstruction, like so with the hepatobiliary tract, the gallbladder. If there's fat buildup on that area and the bile is not able to be excreted, since the obstruction is causing irritation, that may trigger either chemical or mechanical dysfunctions. Therefore, it causes pain. And last but not the least, it may be trauma. It may be a blunt force trauma. It may be a trauma because of the intra-abdominal pressure. So it's interrelated to each other. So you as an health examiner must be able to differentiate what types of pain that the patient is experiencing and use cold mnemonic as thoroughly during the assessment data. Okay. So what are the types of pain? So when we say visceral pain or organ pain, okay. So this pain occurs when the pain receptors of the pelvis, abdomen, chest, and intestines are activated. So basically, when we say visceral pain, it's more of the organ having its pain. You experience it when the internal organs and tissues are damaged or injured. Visceral pain is vague, not localized. Usually, it's generalized. The patient would be just saying na, oh, my whole abdomen hurts. But it sometimes you have to further assess it to pinpoint the location and the organ which is affected. Usually, it's not well understood, and it often feels like a deep squeeze, pressure, or aching. Okay, so usually when your patient says that I feel a little bit of squeeze here in my stomach area, and it feels like it's being pressed over, or sometimes it aches. Suddenly it hurts, but it's not sharp in origin. Usually, it's more of a visceral pain. Okay, so here is a diagram. Felt when noxious stimuli is affected the abdominal viscous. It may be dull. It may be also characterized of gowning or burning. And usually, you could see the patient having this kind of pain that is sweaty, usually cold sweats, and nauseated, having the urge of vomiting. Okay. Next type of pain is your parietal pain. It's defined as a sharp, localized, and a pinpoint specific location. Okay, difference from visceral and parietal pain. The visceral pain is generalized. You could not pinpoint it, but the parietal pain is on a specific spot. Okay, so here is a diagram for parietal pain. It felt precisely localized. It's intense, so it's really extreme. The patient would be grading it in a scale of 1 to 10, 10 being the most painful. The patient would be grading it above 5 or 6 onwards to 10. And it may be aggravated by movement. Usually, parietal pain would be your appendicitis. That's the notorious thing. When you move a muscle near it, it only produces pain on a specific spot. Okay, let's move on to the next type of pain. This one is referred. Okay, so let's just review. For your visceral pain, it's generalized. For your parietal pain, it's more specific. And for your referred pain, it's perceived in a region. Because of the nerves, the body is connected by nerves. Usually, other parts would radiate and innervate the source of pain. So usually, when we say revert pain, it's felt remotely in areas supplied by the same neurosegment as the deceased or affected organ. For example, uh, the nerves for your stomach and your heart is just as um like, how will I term it in the simplest term? Basically, your cardiac and stomach area has just the same pain. Usually, some would refer their chest pain, or some would refer heartburn as masking chest pain. As what Sir Leo before had taught you, sometimes patient having chest pain would be complaining of uh, usually feeling like a heartburn or indigestion. So this is what you call referred pain. Your heart has a problem, but since the supply of your abdominal area is connected with your cardiovascular system, usually it would be referring it as symptoms of your abdominal problems or discomforts. So those are types of referred pain. It's well localized and it appears within the visceral stimulus. Okay. Okay, so what are the types of abdominal discomfort? We have here indigestion. Medical term for indigestion is pyrosis. Okay, so feeling irritated. It's often described as heartburn. It may be indicated as an acute or gastric disorder. It may include hyperacidity, gastroesophageal reflux or GERD, peptic ulcer disease, stomach cancer. These are your probable signs. So if ever the patient is experiencing indigestion, use cold spa, okay, as a mnemonic for it, okay, so that you could further assess the cause of pain or discomfort. Another type of abdominal discomfort is your nausea and vomiting. So nausea and vomiting may be due to several factors. It may be because of gastric dysfunction. Okay, let me just underline it. Gastric dysfunction, digestive disorders, dietary intolerance. Okay. Psychological triggers. You ate your food but you're really stressed. It may make you feel nauseated and vomiting. After strenuous exercises, especially after eating, you just done eating, you performed abdominal exercises or workouts, it may cause either nausea and vomiting as well. If you're traveling and you're in a stable moving vehicle, it may be also caused by motion sickness. Okay, so it's imperative to determine the triggering factors for nausea and vomiting. For example, the patient is just stressed. It might not be related to the abdominal assessment, but since it's psychological, you just ask the patient to relax. You divert the patient so that nausea and vomiting would subside. We don't need every time the patient is asking for medication. Usually, triggering or identifying the triggering factors would help in relieving this kind of discomfort. Okay. So, if ever the patient is able to vomit, a part of the assessment would be your input and output. I guess this has already been taught to you in fundamentals of nursing. Uh, Note the amount of the vomitus. If the patient could do it in estimates, how many cups of vomitus could you measure it? What's the color? Okay. After having vomited the food that you ate, is does the patient felt relief, or is he or she experiencing the same troubles or discomfort? So as a nurse assessing this, you must be keen on getting this data on abdominal discomfort. Next one is actually this is not more of the abdominal discomfort, but we just include this one. This one is appetite. So ask the patient if he or she has lost the appetite. Usually, the loss of appetite is termed as anorexia. Sir, is anorexia abnormal? It's just the loss of appetite. It does not mean necessarily that it's abnormal. Sometimes, di ba, when we have colds, we have loss of appetite because of the inability to smell food or process the food properly. So, this is just a part of our or a symptom in your abdominal problem or discomfort. Okay, so this is a general complaint often associated with disorders. Not necessarily the patient having anorexia, meaning he or she is diagnosed with disorders, but usually related for this one would be disorders, chronic syndromes, cancers, and psychologically disorder. Okay, carefully correlate the appetite changes with the dietary history. That's why when we ask for history, we ask for the 24-hour plan of the patient of what he or she have taken in. Okay, another discomfort would be bowel elimination. This is either the absence or the excess of bowel movement. Okay, so changes in bowel patterns must be compared actually with the usual pattern for the patient. Okay, so normal frequencies vary from 2 to 3 times per day to 3 times per week. Okay, so this one allows the patient to describe the stool and stool patterns. So we have the mnemonic here, COCA, meaning, let me just share it, COCA, color, odor, consistency, okay, and then amount. This one is your mnemonic for that. It's COCA. Okay, so for the consistency, um, was your passing of stool frequent? How many times per day? Okay, so the patient will describe it. Have you um have please describe the odor of your stool. Usually it's foul smelling. Sometimes it's odorless. Sometimes it reeks blood, or sometimes it smells like other scent. So it might describe, you may verify it with the patient. Color, is it dark? Is it bloody? Is it green, brown? So you could indicate it. And the amount, if the patient could quantify it. Okay, so let me just backtrack. So the consistency, it's what I've described earlier was the frequency. Consistency is it hard, soft, formed, watery. Those are the consistencies. You could ask your patient. The frequency, sorry, I've mistakenly made it for the frequency. For consistency, it's usually soft, formed, watery. Okay. For the odor, it's foul smelling or non-smelling. For the color, you just describe it. Is it black, um, red? brown, green. So that's for the color. And for the amount, is it small in amount? Usually it's less than a cup size. Moderate in amount, usually it's in a cup size, and more than it, it's beyond the cup size. Okay? And always ask when was the last bowel movement for your patient, because sometimes they have incidents of constipation. They would tell you na, my last movement was 4 days ago. So that's something that you could need to consider or refer to. Okay? So we have two types of disorders in your bowel elimination. We have first your constipation. So what are the reasons for constipation? If you're not drinking enough water, you're eating unhealthy diet, it causes you to be constipated. There are some medications that may cause constipation. So read the inserts of medication, especially to clients. You might be wondering na your client is eating properly and he's drinking a lot of water, but you've noted that he's taking medications. Maybe that medication is causing him or her to have constipation. Check for it. Pregnancy, why does it cause constipation? Because of the baby bump. It uh, narrows the passage of your bowel in your large intestine. It obstructs. That's why, therefore, peristalsis is weak or slow. Therefore, having the client, the female client who is pregnant, to have constipation. Stress may also cause constipation. Change in scenery, if you're not used to the restroom in that area, even if you have to go, um, your stomach would be storing it for a long period of time, therefore causing you to have constipation. Increase in age, since peristalsis movement is decreased towards the years of age, therefore it may cause constipation. And then sedentary lifestyle, if you're not that moving around, you're just sitting or lying down for a prolonged period of time, it may cause decrease in peristalsis. So treatment for constipation may include a healthy diet, high fiber diet, and drinking a lot of water, moving around or physical activity, having massage. Wow, so try massaging. It's to promote peristaltic movement, and medications, your laxatives and stool softeners, for you to be able to pass, or for your patient to be able to pass stools. Next one would be the opposite of constipation. If your constipation is you're not able to pass stool for some reasons, diarrhea is you want to hold the stool as long as you can, but you could not, because it's described as a frequent watery stools for more than 3 or more times per day. So beyond 3 bowel movements and the consistency is watery, that may be a sign of your patient experiencing diarrhea. Okay, it may be acute, persistent, or chronic. So what are the causes of sudden diarrhea? It may be spoiled food, eating of food poisoning, eating food which are spoiled. It may cause you to have diarrhea. You have traveler's diarrhea because of the water you eat. You're not used to drinking the water in that area. That makes your abdominal or gastric area irritated, therefore triggering your bowels to pass on a lot of water. That causes diarrhea. Or stomach flu. Some certain organisms would be causing your stomach to pass off watery stool or irritation. Chronic diarrhea could also be caused by celiac disease, okay, food intolerance. You're hypersensitive with dairy products or soy products, or what we call it's on the tip of my tongue. Lacto intolerance, that's what I want to say. Milk or soy protein intolerance. And we have here medication that may cause also diarrhea. Okay, let's move to the next. Okay, so here we're going to discuss or gather the symptoms. Okay, is there abdominal pain present? So um, when you're asking your patient, did he or she ever experience abdominal pain? If ever there was or there is, what are the triggering factors? The patient may say, after eating, I experienced this abdominal pain. So sometimes it's indigestion. You may consider it like that, or sometimes you could ask the patient the kind of pain. Okay, so you could from there you could build up your assessment tool. Okay, describe the location of pain using your areas, okay, or your regions and quadrants. Okay, and other symptoms present, was there nausea, vomiting, diarrhea, change in appetite after that one? Okay, so you could also ask weight changes. If your patient has decreased appetite for a prolonged period of time, maybe the changes of weight is evident. So he or she might experience weight loss for decrease in appetite, or weight gain if ever there is retention of fluid or waste products inside the abdominal area. Okay, so it's important to ask the patient for this one, for the subjective data. For the past history, you ask for previous abdominal surgeries, traumas, injuries, or medications. Why is this important? Because abdominal surgery causes stress or alters the movement of your normal digestive system. Therefore, would cause the patient to have either hyperactive bowel movement or slow bowel movement, especially with the medications as well. Okay, question, sir. Would we be determining this one in our assessment? If there is no pain, so just say in your return demo that there is no abdominal surgery, trauma, injury, or medication. Since assessment for abdominal pain has already been assessed in the previous, um, there is no treatment. You could say that for number two. And for number three, be honest. If the patient has laboratory works like colonoscopy, EGD, or esophageal gastroduodenoscopy, the visualizations of your abdominal area or digestive tract, kindly indicate those. If there are any lab works for the patient that involves, that involves your gastrointestinal system, digestive, or other works, or other systems that involves the abdomen, please include it. Okay. You could also say in your return demonstration that the patient has the whole abdomen ultrasound, so visualization of your abdomen via ultrasonography, or either CT scan of the whole abdomen, or either X-ray of the abdomen. You may indicate that in your assessment as well. Next would be for the familial history. Ask if the patient has um, history in the family who has gastric CA or stomach cancer, colon cancer, or liver cancer, hepatic CA. Okay, so those are the layman's term. For your stomach, the cancer for your stomach is gastric CA. For your colon is colon CA as well. For your liver is hepatic cancer. That's the cancers for this given state, this given organs. Okay, so for abdominal pain, if is there a family member who is experiencing abdominal pain, appendicitis, colitis, bleeding, or hemorrhoids? Sir, why do I have to ask this one? Okay, so number two and number three are related to each other because a member of the family having abdominal pain, appendicitis, or colitis, bleeding, or hemorrhoids has the tendency to eat the food which another family member is preparing or is consuming. Okay, so it's part of the familial history. So, for example, the family is a vegan, practicing vegan, or heavy meat eaters. They drink a lot. They, as a family, or they consume a lot of meat or fatty food. Therefore, one symptom for one his family member, which is close, may be a considering or risk factor for this person that you are assessing. Okay, so number three, ask who is responsible for the nutrition of the family and what type of diet that they are taking as well. Okay, so for the subjective data or lifestyle, we have here the lifestyle and health practices. We ask for smoking, the amount. Usually, smoking could cause disruption in the gastrointestinal system for long term. Alcohol use, it may lead to your liver diseases or uh, peristalsis slowing. Diet, what kind of food and drink that he or she had taken in 24 hours. You could note from here if he practices high fiber diet, if he or she is consuming food that could be stool softeners as well. It may be the cause. You may ask this one because this one is pertinent within 24 hours, especially if your patient has bloody stool or dark colored stool, usually eating or consumption of chocolates. You could hear this for diagnosed with dengue patients to avoid dark colored foods or dark chocolate, because it might alter the color of the patient's stool. That's why diet within the 24 hours is important. If the patient is on medication or having diagnosed with hyperacidity or ulceration, is he taking antacids or proton pump inhibitors for the patient not to have an irritated gastric lining? Let me turn on my camera as well. Or we could ask the patient what medications he or she using as part of the abdominal area care. So let me just emphasize again what I have said earlier, that abdomen is not just limited to your digestive tract. It's also involving your reproductive, immune system, and circulatory or urinary system. So any medication for your BPH, for urinating, may be included in the part of this assessment. So ask your patient how much fluid he or she is taking, because fluid intake may indicate um, storing of large amount of fluid. Maybe your patient drinks 3 liters per day and you're wondering why he or she has distended abdomen, okay, upon your assessment, because he or she might be taking a lot of fluid. You may take note of that, especially in palpating the bladder and he or she is just holding it because of the examination. If he or she has a tendency to have large amount of fluid, just take note of it. Sir, how could I ask my patient for this to be more specific? You could say that how many glasses of water can you consume, standard glass, calibrated glass for that patient. Or if ever he or she is fond of drinking in a mineral bottle, you could estimate it as my patient is able to consume 1.5 liters of water, as he or she stated, for his daily consumption of fluid. Okay, exercise amount, this is important, the sweat and the movement of activity, especially in peristalsis. That's why we're asking this one. Causes of stress, this might cause irritability in your gastrointestinal system, either constipation or diarrhea in some parts. Okay, it may affect eating and elimination patterns, as I have already stated. And the past actions with abdominal pain or problem. Does does he or she do self-remedy? Okay lang ba siya sa, is he or she okay with massage? Does the pain is relieved with massage or positioning? Okay, so any actions that would alleviate pain, you must take note of it. Okay, so for the family history, I think this one is just repeated. Okay, now we're going to the objective data, but I'm going to cut this video here, and gathering of objective data would be later on further discussed when you are going to do your checklist. So with this one, I hope you've learned something. I hope that you are refreshed as well, and you are ready to assess the abdominal system. So with that, good day, God bless, and keep safe. Bye bye.